Um, Good morning this morning. With you is dental therapist Aliu Khalid. This morning, I would like to deliver a lecture which is going to talk more on the techniques for administration of local anesthesia in the oral cavity. But before going deeply into discussion of the administration of anesthesia, it is very important for us to have a clear understanding of the oral anatomy. And on the aspect of the oral anatomy, we are going to focus in the areas in the oral cavity that will be affected by this administration of the anesthesia. With this, in the oral cavity, which is part of um, the skull, the skull composes of the face and the cranium. And on the cranium, we have nerves, which these nerves are responsible for the transmission of sensation throughout the oral cavity and part of the cranium. And on this note, we have cranial nerves, which there are 12 pairs of cranial nerves. When we say pairs, we refer to as a structure that comes in two forms, which we have one from the left part and the other from the right part. Now, to this note, the 12 cranial nerves compose among them some that are parts or responsible for the provision of sensation in the oral cavity. Some of the cranial nerves include olfactory nerve, optic nerve, oculomotor nerve, trochlear nerve, trigeminal nerve, abducent nerve, facial nerves. These nerves are named serially, which Roman figures are used in naming this number. The most important of this cranial nerve that is responsible for provision of sensation in the oral cavity is the trigeminal nerve, which this trigeminal nerve is the fifth of this cranial nerve, which is seen as the most largest of all cranial nerves. These nerves provide sensation, is a mixed nerve, which means that it provides sensation for the sensory and motor neurons. Now, we are going to make emphasis on our discussion on the trigeminal nerve. The trigeminal nerve has three branches, which are, now, like we have said, the trigeminal nerve is the fifth of the cranial nerve, which also have three branches, which these branches are the ophthalmic nerve, the mandibular nerve, and the maxillary nerve. Our area of discussion is going to exclude the ophthalmic nerve, which is that nerve that provides sensation to parts of the eyes. We are going to focus our discussion on the maxillary nerve and on the mandibular nerve. Now, let's start with the maxillary branches of the trigeminal nerve. The maxillary branch also have several other branches that are all responsible for the provision of sensation. Our discussion on this is going to be a classification of these nerves based on provision of sensation for either parts of the gingiva or palate or to the teeth root itself. Now, let's start with a discussion on the part of the gingiva. Looking at the palatal region, the nerves that provide sensation to the palatal region of the maxillary teeth are the greater palatal nerve and the lesser palatine nerve. The greater palatal nerve is the largest, which provides sensation to the palatal region from the fourth teeth to the eighth teeth. The fourth teeth, like we have known, is the first premolar to the second premolar to the first molar to the second molar and the third molar region of the palatal gingiva, while the lesser palatal nerve provides sensation to particularly the anterior teeth, which is the central incisors, the lateral incisors, and the canine. Now, on the aspect of the facial part of the gums of the maxillary teeth, which is right from the labial area to the buccal area of the maxillary gingiva. Provision of sensation is provided by the anterior superior alveolar nerve, middle superior alveolar nerve, and the posterior superior alveolar nerve. The anterior superior alveolar nerve provides sensation to the labial region of the gingiva, which is from the first to the third teeth, while the middle superior alveolar nerve provides sensation to the premolars, which is 4 and 5, while the posterior superior alveolar nerve provides sensation to the first molar, second molar, and the third molar. Now, coming to the teeth itself of the maxillary area or the maxillary dentition, sensation is provided by anterior superior alveolar nerve, posterior superior alveolar nerve, and middle superior alveolar nerve. The anterior superior alveolar nerve provides sensation to the anterior teeth, which is central incisors, lateral incisors, canine, while the middle superior alveolar nerve provides sensation to the first premolar, second premolar, and also the mesial roots of the first molar. The posterior superior alveolar nerve provides sensation to the other two roots of the first molar, second molar, and the third molar. So this is provision of sensation by the for the maxillary teeth. Now, on the maxillary teeth, like we have said, the middle superior alveolar nerve provides sensation to the first premolar, second premolar, and the mesiobuccal root of the first molar. Yeah. So now, coming down to the maxillary teeth, the provision of sensation is similar to the maxillary teeth here on the mandibular area, which provision of sensation is provided in different categories, which we will look at the teeth first, and later we'll come to discussion of the gingiva. On the teeth, provision of sensation is provided by the inferior alveolar nerve. So the inferior alveolar nerve is a long nerve that provides sensation to the central incisors, the lateral incisors, canine, first premolar, second premolar, first molar, second molar, and the third molar of the mandibular teeth. While provision of sensation on the gingival area is also categorized into two. We have that which is being provided to the we have that which is being provided to the lingual region, which is the region that faces the tongue. This is being provided by the lingual nerve. So the lingual nerve provides sensation to the entire gingival area of the mandibular teeth. Now, coming to the facial region of the mandibular teeth, which is the labial area and also the buccal area, it is being provided by two nerves coming together. Firstly is a long buccal nerve. The long buccal nerve provides sensation to the 6, 7, and 8, which is first molar, second molar, and the third molar. While provision of sensation for the first to the fifth, from the first to the fifth teeth is being provided by the mental and the incisive nerve. It is their responsibility to provide sensation at this region. So, this is the first part of our lectures. Coming soon, we are going to go straight forward to the description of how we are going to start administration of anesthesia. Without an understanding of these nerves, it is going to be difficult for you to have an understanding of how you are going to administer anesthesia. Thank you very much for listening.